Let's discuss diagnosis through the tongue and introduction. Tongue diagnosis is one of the ways to detect diseases in traditional Chinese medicine, and the tongue coating is particularly important in this method. From the perspective of PCM theory, the color of the tongue reveals the nature of the disease and the status of the vital qi. The tongue coating can also tell the depth of the pathogenic qi has penetrated into the body and detect the presence or absence of stomach qi. The moistness of the tongue coating indicates changes in the 6 climatic exopathogens and the possible damage that has been done to the body fluids. PCM teaches that the tongue is an orifice where early signs of problems manifest and to which many meridians and collaterals in the human body are connected. Therefore, the body's meridians and Zhang Fu organs, the four-level theory of being or nutrient, Wei, defense, Qi, vital energy, Shi, blood, and the external and internal, the yin and yang, cold and heat, and deficiency and excess, all are reflected in the tongue. Being the result of fumigation by the stomach qi, the tongue coating manifests the changes in the tongue mucosa. All the 5 Zhang organs receive qi from the stomach so that the tongue can be used as a means to determine the health status of the 5 Zhang organs, detecting cold or heat and deficiency or excess. Tongue diagnosis relies mainly on the changes that happen to the tongue shape, color, dryness, and coating. Such information will uncover the nature of the pathogen, help differentiate the types of syndromes of Ying, Wei, Shi, and Shi, and determine the extent of body fluids. The tongue consists of 4 parts, the tip, center, root, and sides. PCM further divides the tongue body into upper, middle, and lower burners, with the tip serving as the upper burner, the middle as the middle burner, and the root as the lower burner. The relation between the tongue's parts and the Zhang and Fu organs is that the tip connects to the heart and the lungs, and the middle connects to the spleen and the stomach. The sides of the tongue connect to the liver and gallbladder, and the root connects to the kidneys. Here is an illustration of the tongue, its distribution of the pertaining Zhang Fu organs in the tongue. Number 1, the tip corresponds to the upper burner, the heart and the lungs. Number 2, the middle, corresponds to the middle burner, spleen and the stomach. Number 3 is the root, corresponds to the lower burner in the kidneys. And number 4, the sides, corresponds to the liver and the gallbladder. When conducting a tongue diagnosis, attention should be paid to some confounding external factors to avoid misdiagnosis. Instead of using a dim electrical light at night, soft natural light during the day is recommended. Maintaining a sitting position during the tongue examination. Stick out the tongue naturally, keep it relaxed, level out the tongue surface, and let the tongue body droop naturally. Certain foods and drugs can affect the color of the tongue coating, presenting a false color. We should ask more questions in order to truthfully identify its color. The condition of the oral cavity may also affect the appearance of the tongue. For example, missing teeth can result in a thicker tongue coating on the affected side. Crowns can leave teeth impressions on the sides of the tongue, and those who breathe through the mouth while sleeping may develop a thicker tongue coating. To avoid misdiagnosis, we should exercise caution while examining the tongue. Thank you for your attention.
We proceed to interviewing factors affecting pain. The main factors affecting pain are pressure, temperature, food and drink, bowel movement, and rest. Pain aggravated by pressure indicates a full condition, which may be dampness, phlegm, chi stagnation, blood stasis, or retention of food. Aggravation by pressure in full conditions is common in abdominal pain, stomach ache, menstrual pain, and joint pain. Next is pain ameliorated by pressure. This indicates a deficiency condition, for example, abdominal pain, stomach ache, menstrual pain, and joint pain. Temperature. Alleviated by warmth. If the pain is alleviated by the application of heat, such as a hot water bottle, this indicates that it is due to cold or yang deficiency. For example, backache, joint pain, stomach ache, abdominal pain, menstrual pain. If a pain is alleviated by hot weather, this indicates that it is due to cold or yang deficiency, like back pain and joint pain. Similarly, if the pain is aggravated by cold. Alleviated by cold. No pain is generally alleviated by the application of cold, except in the case of acute joint sprains. Similarly, no pain is usually alleviated by cold weather. Pain aggravated by eating indicates a full condition of the stomach. Pain ameliorated by eating indicates an empty condition of the stomach. Aggravated by drinking cold liquids indicates a cold condition of the stomach. Aggravated by drinking hot liquids indicates a hot condition of the stomach. Ameliorated by drinking warm liquids indicates a cold condition of the stomach. Ameliorated by drinking cold liquids indicates a hot condition of the stomach. If the pain is ameliorated by a bowel movement, this indicates a full condition of the intestines. If aggravated by a bowel movement, this indicates an empty condition of the intestines or spleen. Pain ameliorated by movement indicates stagnation of qi, for example, abdominal pain, or cold, for example, backache. Aggravated by movement indicates deficiency of qi or blood, like backache. Ameliorated by rest indicates a deficiency of qi or blood, backache, joint pain, menstrual pain. Aggravated by rest indicates stagnation of qi. For example, joint pain, backache, headache. Stasis of blood, example, joint pain, backache, headache, or cold, example, backache. Thank you for your attention.
Let us go to pattern discrimination. The topic is TCM pain discrimination. TCM frequently associates various specific pathogenic factors, pathological conditions, and patterns to pain development. At the same time, it is possible to support diagnosis and treatment of different patterns and pathological conditions according to the different types or qualities of pain. Moreover, different types of pain itself could be approached and treated differently according to TCM discrimination. Discrimination of pain according to different pathogenic factors. So here we look at the pathogenic factor, the quality of pain, and the accompanying symptoms. So for the pathogenic factor of wind, the pain will be moving, wandering, erratic or migratory, changing quality, abrupt onset, acute, and paroxysmal. And that symptom is aversion to wind, slight fever, floating pulse. When there is cold, the quality of pain will be fixed, sharp with stiffness, and the accompanying symptoms will be improved by warmth and movement and aggravated by cold and rest and tight pulse. If there is heat, there will be a feeling of warmth, redness, and swelling and difficult movement. There will also be fever, aversion to heat, thirst, irritability, restlessness, and rapid pulse. When there is damp, the pain will be very localized and does not move. There will be heaviness, numbness, deep, heavy, and dull swelling without edema, and appears gradually, and it is chronic. And the accompanying symptoms will be aggravated in damp weather, heaviness, tiredness, especially in the lower part of the body and limbs, and slippery pulse. When there's qi stagnation, the pain will be moving, diffuse and distending, and soft. The symptoms will be aggravated by emotional disturbances and bowstring pulse. When there's blood stasis, the pain will be fixed, stabbing, hard, and refuses pressure. The symptoms will be worse at night. There will be purplish discolorations, purplish tongue, and choppy pulse. So here we'll look at the quality of pain and the major pattern correspondences. If the quality of pain is sore, then that is a deficiency of qi and blood. If there's distending pain, it is qi stagnation. Stabbing pain is blood stagnation, which is an after effect of physical trauma. When there's sharp pain, it's an acute qi stagnation and blood stasis. When there's throbbing pain, it's hyperactivity of liver yang or toxic heat invasion or accumulation. When there's burning pain, that's an invasion of exogenous wind heat or internal heat. For colic pain, that's invasion of exogenous cold or accumulation, and stagnation of qi in the small intestine, gallbladder, or uterus. And it's a substantial blockage such as stones, sand, stagnant blood, or phlegm. When there's a whole body pain that is a pattern of excessive factors such as qi stagnation, blood stasis, or accumulation of damp, and qi and blood deficiency. If there's wandering pain, that could be painful obstruction primarily due to wind invasion, qi stagnation, and mostly in the abdomen and chest, and it is closely related to emotional changes. When the pain is in a fixed location, that is blood stasis, where there's invasion of exogenous dampness or damp accumulation. When there's pain with spasm, it's an invasion of exogenous cold or wind cold or liver blood deficiency. When there is a pain with a suffocating feeling, it is qi stagnation or damp phlegm accumulation. There's painful obstruction in the chest, combined qi stagnation and phlegm accumulation. When the pain is radiating, that is qi stagnation and blood stasis. There's accumulation of stones or sand in the bowels, and there's liver and gallbladder qi stagnation. When there's pain with contraction, it's an invasion of exogenous cold. There's formation of deficiency, cold, and congelation due to yang deficiency. When there's pain with heaviness, it's an invasion of exogenous dampness and damp accumulation. When there's pain with swelling, it's blood stasis following trauma and damp accumulation and toxic heat. If it's pain that refuses pressure and massage, that's excessive factors like qi stagnation, blood stasis, cold accumulation, and food stagnation. When there's pain that is relieved by pressure and massage, that is the deficient factor, like qi or blood deficiency or yin or yang deficiency. When the pain is relieved by warmth, it's an invasion of exogenous cold, formation of deficiency cold, and congelation due to yang deficiency. When there's pain relieved by cold, that's an invasion of exogenous heat or heat accumulation. When there is a constant pain, that is an excessive factor. An intermittent pain is qi, blood, yin, or yang deficiency. Thank you so much for your attention.
Let's proceed to differential diagnosis in Western and Chinese medicine, and let's talk about depression. In Western differentiation, the causes of depression include, first, prolonged emotional strain. This includes disappointment, grief, sadness, childhood events such as abuse or neglect, and social isolation. Another cause is prolonged physical pain or having a major illness. This manifests with depression, fatigue, malaise, other symptoms according to physical cause of depression. Another cause is hypothyroidism. This will manifest with depression, with weakness, fatigue, cold intolerance, weight gain, joint or muscle pain, thin or brittle hair, brittle fingernails, and constipation. Another cause is addiction. It could be alcohol abuse, where there is depression with solitary drinking, making excuses to drink, lack of control over drinking, aggressive behavior, hostility if confronted with problems, neglect of food intake, neglect of physical appearance, shaking in the morning, and confusion. Or it could be drug abuse, where there is addicted to behavior patterns as in alcohol abuse, together with violent mood swings and unpredictable behavioral patterns. Another cause is chronic stress. There will be depression with muscle tension, headaches, sweating, dry mouth, difficulty swallowing, rapid or irregular heartbeat, diarrhea, frequent urination, irritability, poor concentration, and low libido. Another cause is nutritional deficiencies, such as folate and omega-3 fatty acids. And another cause is sleeping disorders. There is depression with problems falling or staying asleep, problems with staying awake, and irregular sleep patterns, sleep disruptive behaviors. Let's now go to Chinese differentiation of depression. Let's start with organ interrelationship. We can look into the kidney and liver and the heart and spleen relationships. These are the Shang cycle relationship or the generating pattern relationships. Another is the relationship between the pericardium and the heart. These are belong to Julian meridians. Another is the kidney and heart relationship, or the Kuhl cycle and the Shaoyin meridian relationship. Another is lung and heart relationship. This both involves the chest qi and as the relationship of the controlling or the Kuhl cycle. Another relationship we should look into is the lung-liver relationship. And these organs have the full cycle relationship. The heart or the Shaoyin and the gallbladder, the Shaoyang relationship. Next, we look into the type of depression. If there is sighing, moodiness, wound up, repressed anger, frustration, resentment, feeling of being trapped, inability to move forward or see the future, there's guilt and timidity. This indicates an imbalance of the wood element. If there is vexation, agitation, lack of joy, inability to communicate, hurt, rejection, defensiveness, these all are indicative of a disharmony of the fire. If there is oppression, anxiety, sorrow, grief, lack of self-worth, pointlessness, inability to let go, detachment, these are indicative of a disharmony of the metal element. Repetitive thinking, inability to resolve, worry, entrenched spite, insecurity, lack of support, this indicates a disharmony of the earth. Dread, fear, mental debility, feeling of being overwhelmed, feeling can't cope, phobias, and helplessness indicates a disharmony of the water element. Mental restlessness indicates yin deficiency, postnatal depression, for both heart and gallbladder deficiency, and blood deficiency. Etiology is first due to diet, as like due to taking or consuming excessive damp and heat-producing foods causing fire and phlegm. A constitutional weakness, it could also be due to overwork, a taking of drugs which deplete yin and blood and disturb the shen. It could also be due to bereavement, shock, illness, life circumstances, and pain. Now let's go to Zhang Fu patterns. Here we have stagnation of liver qi, lungs not descending and diffusing, stagnation of heart qi, heart and gallbladder qi deficiency, heart liver blood stasis, heart liver blood deficiency, heart yin deficiency with empty heat, kidney yin deficiency with empty heat, liver yin deficiency with empty heat, and spleen and kidney yang deficiency. Thank you for your attention.
We discussed full viscera and irregular organs. This time we focus on sanjiao. Sanjiao is the collective term for the upper jiao, middle jiao, and the lower jiao. These together constitute one of the 6 full viscera. They're located in the thorax and the abdomen. There have been many explanations of what it is, and even now there is no consensus regarding its form or substance. Nevertheless, the functions of the sanjiao may be summarized as follows. So here we could actually see the diagram of the sanjiao. So it serves as a qi passage for the blood. These are the blood vessels and the meridians and collaterals. And as you can see, this serves as a conveyor of the body fluids and the yin qi. So passage of water fluids. So this has a lot to do with the ureters, the urinary bladder, and the urethra, control of excretion of the urine and feces. So for the large intestine, the sanjiao plays a role in the transportation of wastes. So it is also a deep connection with the vital gate, which, as we all know, gives rise to our primordial qi. And this can go towards transforming essence from diet into blood, or it will go to nourishment of the viscera and meridians. So after transforming the essence from diet into blood, then we're going to form the nutritive qi as a result of the decomposition, digestion, and assimilation of diet by the spleen and stomach. Then we have the nutritive qi. Okay, so primordial qi, nutritive qi, and the fresh air nutritive qi, until eventually we come up with the genuine qi, and which is disseminated into the entire body. So the upper jiao is known as the mist generator, the middle jiao is the ferment chamber, and the lower jiao as the drainage. Pathway for the genuine qi. Genuine qi is the motive power of the vital activities of the human body. It is rooted in the lower jaw and originates from the kidney. It is transformed from innate essence. Genuine qi must use the pathway of the sun jiao in order to move properly and reach the entire body in order to carry out its action of stimulating and promoting physiological activities of all the organs and tissues. Chinese medicine believes that because the sun jiao is a thoroughfare for the movement of qi, it controls all qi of the body, including qi of the zangfu viscera and the meridians, as well as nutritive qi and defensive qi. Second, controlling qi transformation. Transformation of qi refers to the complex changes of all types of substances. Transformation of qi takes place through the joint actions of many viscera, and among them, the sun jiao is a very important part. It is the pathway for transportation of food and drink and for elimination of wastes. The reason is that the sun jiao is the pathway for the movement of genuine qi, and genuine qi is the motive power for the transformation of qi, which stimulates and promotes metabolism of the human body. Third is passage for water fluids. The plain question states, the sun jiao is the waterway dredging official in charge of waterways. Thus, it has the function of maintaining the patency of the waterways and of moving fluids. The metabolism of the body fluids is the joint action of the lung, spleen, kidney, and other organs, but the sun jiao is the essential pathway. If the sun jiao functions normally, the waterways are clear and metabolism of water and fluids proceeds smoothly. If sun jiao is obstructed, movement of qi and fluids is impeded. This may lead to oliguria, edema, and ascites. Fourth is sectional division of the body. In Chinese medicine, sun jiao is also a concept used for dividing the body into 3 sections. Each section contains its own visceral organs. Upper jiao contains the heart and the lung, middle jiao, the spleen and stomach, lower jiao, liver, kidney, large and small intestines, urinary bladder, uterus, and other organs. In terms of anatomical location, the liver should belong in the middle jiao, but because in Chinese medicine, the liver shares the same source as the kidney and the two are closely interconnected in physiological functions, it is assigned to the lower jiao. Functional characteristics of the 3 jiao are as follows. The upper jiao is like mist. The upper jiao governs dispersion and distribution. In other words, heart and lung work together to convey and distribute essential substances throughout the body to warm and nourish, like the sprinkling of mist and dew. The middle jiao is like ferment. The principal functions of the middle jiao are those of the spleen and the stomach. These functions include reception and digestion of food and drink, absorption of essential substances, evaporation of body fluid, and transformation of essential substances into blood and other fluids like fermenting. And number 3, lower jiao is like a drain. Principal functions of the lower jiao are to separate, clear from turbid, and to excrete urine and feces like wastewater pouring through a drain. Thank you for your attention.
Let us go to diagnosis according to Zangfu organ patterns. The topic is urinary bladder imbalances. In Chinese physiology, the urinary bladder plays a wider role than it does in Western medicine physiology. In Western medicine, the urinary bladder stores and expels urine. It also does this in the Chinese medicine physiological model, but here it has the additional function of helping to transform the impure body fluids that it receives from the lung and small intestine. For the urinary bladder to be able to fulfill these functions, it is dependent on kidney yang qi. The kidney yang warms and activates the urinary bladder and provides it with the necessary qi and warmth to be able to transform the impure fluids and transmit the pure fluids upwards through the sanjiao, as well as enabling the urinary bladder to retain the urine until it is expelled out of the body. The expulsion of the urine from the urinary bladder is again dependent on the strength of the kidney yang qi. This means that when the urinary bladder is incapable of performing its functions, it is not due to a deficiency condition in the urinary bladder, but is because of either a deficiency of kidney yang or the presence of pathogenic qi. If there is kidney yang deficiency, the urinary bladder will lack the necessary qi and heat to be able to carry out its functions of transforming the impure fluids, sending pure fluids upwards, and retaining and expelling urine. This will manifest with an increased volume of urine that is pale. There will be frequent voiding of copious amounts of clear and pale urine, because fluids that have not been transported will have seeped down to the lower jowl. The urine can also be cloudy due to the fluids not having been transformed. Urination will also be more frequent, and there may even be incontinence when there is kidney yang deficiency, because kidney yang will not be able to hold the urine inside the urinary bladder. On the other hand, there can also be problems voiding urine when there is kidney yang deficiency. Kidney yang is the force behind this voiding function, expelling the urine from the urinary bladder. Kidney yang deficiency can therefore manifest with symptoms such as incomplete emptying of the urinary bladder, a weak stream of urine, or post-urination dribbling. Although these symptoms are due to a dysfunction of the urinary bladder, the treatment will be aimed at tonifying kidney yang, because this is where the root of the problem lies. As well as the deficiency of kidney yang, another cause of urinary disturbances is the Qi mechanism of the urinary bladder being obstructed or disrupted by certain types of pathogenic Qi. Damp is often involved in excess patterns of imbalance in the urinary bladder, as it inhibits the movement of Qi and can block the Qi mechanism in the urinary bladder, which impedes transformation and transportation of fluids and blocks the excretion of urine. The blockage will manifest in difficulty in urinating. There can be difficulty voiding the urine or in emptying the urinary bladder completely. The dampness can also result in the urine becoming cloudy. In extreme cases, the accumulation of dampness in the urinary bladder can lead to the formation of sand or stones in the urinary bladder. The lack of transformation and transporting of body fluids can result in an increased amount of urine in the urinary bladder. Thus, there may be more frequent or urgent urination with copious amounts of pale or cloudy urine. Thank you so much for your attention.
Let's now proceed to etiology in Chinese medicine, phlegm. In the course of certain illness, certain products may be formed under the influence of the actions of pathogenic factors. Once formed, these products may themselves directly or indirectly disturb the viscera and the tissues, resulting in new disorders. Hence, they're also pathogenic factors. The main products in this group are phlegm, rheum, and blood stasis. Phlegm can be generated when water metabolism is disordered. In general, it is viscid and turbid, and phlegm may be classified as visible or invisible. Visible phlegm is sputum. Invisible phlegm is that which has accumulated in organs, meridians, and other structures, though it cannot be seen directly. It occurs in such conditions such as scrofula and cutaneous nodules. The formation of phlegm. Phlegm forms mostly when body fluids stagnate as a result of disturbance in water metabolism caused when the transforming ability of the lung, the spleen, the kidney, and the sanjiao is disrupted by the climatic evils, inappropriate food and drink, or the passions. Now let's go to the characteristic of phlegm disorders. First, obstructing Qi actions and Qi blood circulation. Phlegm moves along with Qi and reaches all parts of the body, but it impedes the ascent and descent of Qi. It can also lodge in the meridians where it can interfere with the circulation of Qi and blood. For example, stagnation of Qi and blood in the limb meridian can cause numbness of the limbs, difficulty in flexion and extension, and sometimes hemiplegia. If phlegm accumulates under the skin, it can induce goiters, scrofula, nodules, cysts, and multiple abscesses. Obstructing action of the visceral Qi. When phlegm accumulates in the body, it can readily impede visceral Qi. For example, if it accumulates in the lung, it can block dispersion and depuration by that organ, and it can lead to chest tightness, cough, expectoration of sputum, labored breathing. If it accumulates in the heart, it can impede the flow of heart blood and can lead to chest tightness and heart palpitation. If it accumulates in the stomach, it can cause failure of the stomach Qi to descend and lead to nausea, vomiting, and epigastric distension. The variety of phlegm diseases. Because phlegm follows Qi and can reach the entire body, it can induce a large variety of disorders, from the skin, tendons, and bones, to all internal organs. This gives rise to the saying, the 100 diseases are mostly due to phlegm. For example, if phlegm lodges in the head, there may be dizziness with blurred vision. If in the heart orifices, there may be mental confusion. And if phlegm fire disturbs the heart, there may be mental derangement. And if in the throat, there may be globus hystericus. Here is an illustration showing the pathological products as a cause of the disease, particularly the phlegm. The organs involved here are the lung, the spleen, the sangao, and the kidneys. Any disharmony or dysfunction among these organs can lead to accumulation of water dampness and the formation of phlegm. If it invades or blocks the heart orifices, it can cause stuffiness in the chest and palpitation and mental derangement. If it invades the head, it can cause dizziness and vertigo. It invades the lung, it can cause cough and asthma. And if it invades in the meridians and the collateral, in the tendons and bones, it can cause numbness of the body and hemiplegia. If phlegm stays in the stomach, it can cause nausea and vomiting. If it stays in the intestines, it can cause poor appetite, intestinal gurgling sound, and abdominal distension. If it stays in the muscles and skin, it can cause edema. If phlegm stagnates in the throat, there is a sensation of foreign body in the throat, and in the sternocostal region or in the chest and diaphragm, there will be asthma and cough and refusal to lie down, and is sternocostal detention and pain due to cough. Thank you for your attention.
We now discuss the emotions. This time we focus on guilt. According to Romans chapter 3, verse 23, for all have sinned and fall short of the glory of God. In him we have redemption through his blood, the forgiveness of sins, in accordance with the riches of God's grace that he lavished on us with all wisdom and understanding. From Ephesians chapter 1, verse 7. Let us draw near to God with a sincere heart in full assurance of faith, having our hearts sprinkled to cleanse us from a guilty conscience, and having our bodies washed with pure water. From Hebrews chapter 10, verse 22. For whoever keeps the whole law and yet stumbles at just one point is guilty of breaking all of it. From James chapter 2, verse 10. Guilt is a pervasive emotion in Western patients. It is completely missing from Chinese medicine books, and one could say that it simply does not exist in the Chinese psyche and soul. It could be argued that guilt is intrinsically related to the Judeo-Christian religions, and especially the Christian religion with its concept of original sin. There are few expressions in Chinese to indicate guilt, and all of them refer to guilt in a legal sense rather than a feeling of guilt. An everyday expression to indicate a feeling of guilt would be yo jue e kon, which means having a guilty feeling, in which jue means guilt or crime in a legal sense. We have never seen expressions referring to feeling of guilt in modern Chinese books. It could be argued that this is due to the fact that in Judeo-Christian societies, the feeling of guilt is pervasive, while in Eastern societies, such feeling is more or less absent. In fact, the concept of guilt is totally absent in all three major Chinese religions of Confucianism, Taoism, and Buddhism. Indeed, Confucius did not even believe in the value of punishment for crimes. It should be stressed that what concerns us here in dealing with emotions is not guilt, but the feeling of guilt, which is totally unrelated to an actual crime or transgression. For example, a person may have committed a crime but feel no guilt at all. Conversely, a person may have committed no crime or transgression, but feel guilty. Guilt can manifest in many different ways. Feeling of responsibility for negative circumstances that have befallen oneself or others. Feeling of regret for real or imagined misdeeds, both past and present. Feeling responsible and guilty for any negative thing that occurs to members of one's family or one's partner, taking responsibility for someone else's misfortune or problem. Apart from the above examples of the consequences of a guilty feeling, this may make a person take very important life-changing steps such as engaging in marriage or taking a job. In other words, a subconscious guilty feeling may play a role in the choice of job or life partner. The previously mentioned are only a few examples of the sort of behavior induced by feelings of guilt. A feeling of guilt may be due to the transgression of social or religious taboos or from having done something wrong that is later regretted. However, a feeling of guilt may also be innate and not related to any specific action. This latter feeling is indeed the most destructive one. Thank you for your attention.